And happy sterile processing week. Welcome to today's OR Today product showcase webinar, McGan Insulation Tester, what every OR nurse should know. Now today we are joined by Kevin Anderson, Senior Manager, Commercial Education Services at Healthmark. OR Today would like to thank our sponsor Healthmark. Since 1969, Healthmark, getting her company, has developed and marketed innovative solutions to help healthcare facilities deliver surgical instruments and other life-saving devices to patients. These include products for effective cleaning and verification of the process, packaging and accessories for proper sterilization, storage and delivery, and tools to identify and secure emergency supplies and equipment. Healthmark will continue to innovate, support and serve healthcare providers and the services that enable quality care. So for more information, please visit hmark.com. Today's webinar, as usual, is eligible for one continuing education hour from the California Board of Registered Nurses, and you can obtain your certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1CE certificate, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Now, just a quick reminder that OR Today is pleased to support the Southeast Councils of Perioperative Nurses Conference, which will take place at the World Gulf Village Renaissance in St. Augustine in Florida, and that's from November the 1st and 2nd. So for more information and registration details, please visit southeastperiop.com. Okay, let's kick off today's webinar by giving away one of our OR Today live lunch call bags to the attendee that can tell me the answer to the following trivia question. As we all know, October is Breast Cancer Awareness Month. What colour ribbon is associated with breast cancer awareness? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll have a live Q&A at the end of today's presentation, so please submit your questions anytime using the questions feature on your dashboard. As I mentioned earlier, our presenter today is Kevin Anderson. So Kevin, you may begin whenever you're ready.
All right, thank you so much, Linda, for the introduction, and thank you for the opportunity. I'm really excited to get into a very different kind of webinar. This is the first time I've done one like this where I get to present a little, but also do some show and tell. And I'm really excited to get into this one because we're going to be talking all about the McGan Insulation Tester, what every OR nurse should know. And just before we get started with that, please understand that no matter what your role is, whether it's OR nurse, surgical technologist, infection prevention, sterile processing technician, this information is for you. It's very important that you all understand this. I would even invite surgeons to watch and learn about this. But let's get started. One of the things we want to cover in this presentation is why is this technology important? That's going to be extremely important when you go to try and implement these kind of procedures, these inspection procedures in your department. You have to know the why. It's extremely important. When you lead with the why, you're going to get better compliance with steps like this. All right. How is this technology used? What does it look like? What does it look like to actually use it with your hands and get physical with it? Use the instruments that are in your department and be able to effectively test those. And lastly, what kind of stuff should you do with this information based on the role in your facility, right? I talked about sterile processing, nurses, surgical technologists. You all have a role to play, and having an awareness of this procedure, the why and how, and what to do with that knowledge is really important, because based on your background in your facility, it will change what you do with that information. So the first thing I want to do is get to our first poll question. Linda, if you would, this is going to help me to sort of understand who's out there in attendance for this webinar.
Okay, we'll give the attendees a few seconds to place their little votes.
Yeah, absolutely.
Okay, right, I'm going to close it and share with you, Kevin. There we go.
All right, we got sterile processing, IP, and OR nurses, and we have some other. All right, excellent. That helps a lot. So Linda, we can go back to the presentation. And we're going to go into actually our second poll question. This is kind of a question to sort of whet your appetite for what I'm about to explain. And hopefully, if you don't already know the answer to this, you will definitely know the answer by the end of the presentation. So in the study conducted by Sharon Rojo, what percentage of nurses experienced an insulation failure in their career that they recognized as an insulation failure? Was it 9%, 24%, 42%, or 50%?
Okay.
All right, we got 50%, which is the majority, who answered 42%. So excellent. And then we also have 24% selected 29, and 50% selected 21%, or 21% of our attendees selected 50%. I said that wrong. But by the end, I hope that 100% of our attendees will actually get the right answer. So that's what we're shooting for, in addition to learning how to use this equipment and why. All right, so I want to lead with this visual. All right, so for those of you that percentage of you that work in the operating room, this is where I want to be able to drive home the knowledge that you're going to learn today. So in a typical procedure like this one, you're using cautery, you're using fine dissection here, and you can see there's only a small portion of the instrument, the tip of the instrument, that is visible, right? There's a lot of that laparoscopic instrument that is off screen. It's totally not visible to you during the operation. And that's why I wanted to show you this visual. Now, the second one I want to show you is on the next slide, and is going to illustrate why this is problematic. It's good for the surgeon, but it can hide unknown problems with insulation. And I'm going to show you that on this one. All right. So take a minute to watch and observe this. Normally, this is just a gallbladder removal. We're trying to expose the gallbladder. We're in the very beginning stages, right? But maybe if you take your eyes a little further away from the scissor, the Metz cautery that's happening, you can see over here, there's an exposure of electrocautery that's hitting an adjacent organ. And it's going to burn a hole through that organ if the surgeon doesn't realize what's going on. Now, those of you who are nurses in the operating room, maybe you're a scrub nurse or maybe you're a circulating nurse, but a lot of times when you get advanced in your career in the operating room, you get all your charting out of the way. You're probably done with 90% of your charting before the doctor even gets to this part. And if that's the case, you could be another set of eyes on the instrument and watching sort of the non-operative side, watching the rest of the instrument to make sure that there are no breaches, that electrocautery is coming through and maybe burning an adjacent organ that was unintended. That's the same if you're a scrub nurse, right? Maybe not so much as a first assistant, because your attention has to be where the surgeon is working, and I understand that. But if you're a scrub nurse or a circulating nurse, this is something you could observe for while you're in surgery. And for those of you who are in sterile processing or infection prevention, this is for your awareness. This is why using your insulation tester every single time you process a insulated instrument, you're preventing this from happening. You are literally saving a life, okay? This is one thing too that harkens back to my experience as an operating room nurse, because there were so many times I worked with a very busy general surgeon, and we would go through and do days and days and days of what felt like nothing but gallbladder removal procedures. But every once in a while, we would have some patient come back inexplicably. There's no obvious reason other than they're having some sort of complication. Maybe they had a fever, or maybe they're having intractable abdominal pain. And what the what the procedure or what we ended up doing was an exploratory laparotomy, looking for whatever could be or could have gone wrong. And I can't help but think about this image right here. How many times did I miss something like that? How many times did any of us who were actually in the room doing this gallbladder removal surgery miss a potential complication? Or maybe it was off screen and there was nothing that we could do. That is a possibility. However, when I went into from the operating room to managing sterile processing, and I learned about this important step in important safety inspection, I learned that we were not doing insulation testing procedures at all. And it went back into my memory, and I thought about those patients, and it drove home the fact that there is no way that those weren't patients that came back because they had unintentional burns. There is no other explanation. And that keep that in mind too when you think about that percentage of nurses that replied to that poll question or that survey question. How many nurses experienced a insulation failure in the operating room? You're not going to report that unless you know it, right? So unfortunately, during all those years that I was in the operating room, I wouldn't have known the origin of that problem. I didn't learn that origin until I went and learned more about sterile processing because I had to, because I was then managing the department. So keep that sort of backdrop and understand this is why I get so excited about this topic, is because I got a lot of different people listening, whether it's OR nurses, sterile processing, IP, I'm sure there's other vendors, I'm sure there's other people out there, administration, that might land on this video. And it's important that everyone understand this risk. There are some people out there that report these issues to the FDA through the MAUDE database. But again, when I was an OR nurse, I didn't even know about the MAUDE database, which is really bad because as OR nurses, if something goes wrong with a piece of equipment in surgery, it's our job to report that to the FDA. And how are you going to report that to the FDA if you don't even know what the MAUDE database is or how to use it? So there's a lot to sort of unpack there, but understand that the knowledge of what's going on in sterile processing and how to care for and handle these instruments and how to inspect them properly is literally going to save your patients. Some of you nurses are going to find that you are responsible for sterile processing departments, especially if you work in an ASC or manage an ASC. And so you're going to need to know all this. Now, a little bit about Sharon's study. I asked a simple question regarding his study in the poll. Of 49 facilities that were visited, 416 insulated instruments were tested. 223 of those failed inspection. Guys, that's 54% fail rate. That is enormous. And it's really kind of embarrassing because the insulated instruments and lap choles and things like that, these have been happening since what, the 70s or something like that. We're now in 2025. We've had ST79 amendments that have gone into great detail on how to test for insulation that date back to 2020. Yes, they released in 2021, but we've been working diligently to try and get this information out there and make sure that people understand and have the awareness and have the competency to make sure this testing gets done, this inspection step gets done. So what else? We have another highlight here. Okay, this is the other poll question that I asked again regarding Sharon's study. 49 facilities, 66 nurses surveyed, and we had 42% of those nurses have experienced an insulation failure. Now, mind you, that was 42% of nurses that knew that they experienced an insulation failure. I would venture to guess, based on my experience, there are plenty more out there that don't even realize that an insulation failure occurred during a surgery that they were a part of. So real big statistic there, almost 50%, and then however many more that just were unaware. All right, so at this point in our webinar, I want to do show and tell. So what I'm going to do is get away from the PowerPoint part and show off the equipment that's right here in front of me and basically demonstrate to you, how is this done? How do we do a proper insulation inspection? Well, you have to have the proper equipment. We have one that is called the McGan Insulation Tester, okay? We have a load of accessories here. We have a clip, we have 2 cords, a green and a red. We have these accessories. I will show you how all of these things work. These are accessories that are unique to this setup, and this one as well. This might be brand new to you all, and this one's gonna be really important too. I wanna go over all this stuff and what it looks like to actually put this into use. Now, really quick, there are only 3 buttons on here. This is a rechargeable unit. I'm gonna turn it on and you're gonna see the readout there, the digital readout there. This is a measurement or a setting of kilovolts. All right, it's not really important that we know what a kilovolt is. We just need to know what the settings need to be and why, okay? So right now I'm gonna set this to 2.8 kilovolts. And these are general rules of thumb that we recommend and that is in our IFU. But I want to explain to you, and I'll further explain later, that the adjustability of the kilovolts is exceedingly important. There are units out there on the market right now where you can only adjust it from high to low. It does not tell you how many kilovolts is being used to test the instrument. And I will illustrate as we go why that's really important. All right, so we have, as you can see, we have we call it our grounding cord. This is our green grounding. It's kind of easy. They're both G words, right? So what I'm going to do is I'm going to take a common instrument. Okay, this one is just a basic, it looks like, wow, this is like a first generation laparoscopic instrument. Yeah, it's very old. There's not even a flush port on that. But you can see from nearly all the way to the tip, all the way to the handle is insulated, and including the handle is insulated. All right, so that's going to be really important that we make that observation and that distinction because we have a lot of different instruments, right? We have instruments with metal handles and insulated shaft. We have instruments where there's no insulation whatsoever. And you might ask yourself, well, why would there be a laparoscopic instrument that doesn't have insulation? Well, this one happens to be a needle driver. So when you're using a needle driver, you're just throwing stitches. You can't really do both at the same time, cauterize and throw stitches. So you're only doing one thing. There's no cautery going on. So the risk of insulation failure or electrocautery burns that are unintended is basically nil. There's nobody's cauterizing at the same time they're throwing a stitch. So those are some things to keep in mind. It's similar to this. This is maybe they decided to insulate it because you could use this in conjunction with electrocautery, but mostly a right angle like this is going to be used for blunt dissection. They're not going to use cautery with this instrument. So we have to be able to look at the instrument we're testing and understand how to test it and what are the nuances to be mindful of. So I already mentioned with this one, we're gonna put our clamp on here, and then what we're gonna do is set this saddle block back up and plug it back in because I unplugged it, all right? And what we're gonna do is we're going to complete the circuit. So there is now kilovolts of current going through this. All right, so when I put this on the post here, I should get a beep when I put this into the electrode because that's going to complete the circuit. And you're going to hear that. Now, I expect to hear that because that's a metal component. What I don't expect is once I get to the black part of this instrument, I should not hear that beep anymore. And as you can tell, once I pushed it further beyond the very tip of the instrument, the beep went away. Now, when I advance this instrument through the rest of the shaft here, I should not get any more beeps. And if I do, that is a sign that this instrument failed insulation testing. So I just do that part. If it fails, it does not pass go. It goes off to the side to the repair bin. There's no circumstance in which that should go back in the set. Now, but it passed the inspection for the shaft, but I'm not done. If it failed, then I'm done. I can put it in the repair bin, but I'm not done because it passed. So now what I have to do is set myself up to test the handle. And it looks like right now I don't have my brush. So what I'll do instead, let's see if I can, actually, if I may, I'll just explain to you. So what I would do is I would take a brush electrode and I would run the brush all up and down this handle right here, okay? And so if you have that and you hear a beep anywhere on the handle, that's identifying a failure in the insulation of the handle. The handle having a failure is a risk to the actual doctor, the user, could be the resident, could be a first assistant, could be the patient, because those of you who work in the operating room, you nurses out there, doc might switch instruments. He might go from his L-hook cautery or something like that. He'll set it right on the patient, right? And then he'll take the suction. But if he accidentally steps or she accidentally steps on the cautery, he could send electricity through that handle and then burn a hole in the drape, and that could possibly reach the patient. So we want to make sure we test the entire instrument, and if it fails anywhere on the shaft or the handle, that goes to the side for the repair bin. Now, we have other accessories here, and I want to just briefly show you that there's more than one correct way to do this. So if you see me demonstrate this, how to do it correctly, but you see someone else doing it differently, don't just assume that they're doing it incorrectly. There are different ways to do it. So I have this tri-hold electrode right here. We're going to plug that in. And what I'll do is with the tri-hole electrode, I have to reset my kilovolts. I'm going to use a 4.2 kilovolts, and I'm going to find the tri-hole that fits this instrument, the diameter of this instrument. And you're going to hear the beep again. Yep, there it goes. And now I'm just going to run at the length of the shaft. And again, we find that we don't have any problems with this particular instrument. So that one is passing inspection. Maybe this one will have a different result. I don't know. Okay, thought I might have heard something there. All right, definitely heard something there. So there are potentially multiple defects with this one. This one's a do not pass go, put the repair tag on it, make sure it goes to your repair vendor, okay? So finding that defect just potentially saved a life down the line. That's why it's really important, no matter what you do or what your program looks like in terms of the insulation testing, education, your procedure and all of that, what matters is that you make sure it happens thoroughly and completely every single time, okay? So I showed you this. Another thing while we're here, and of course, I don't have the brush, so if anyone on my team is listening and wants to run and get me a brush, I will happily take that off your hands and show people how to use the brush. But until then, I will just show you and explain to you how we would use the brush if I had one right now. So here we go. We have this holder right here that is holding this bipolar forceps. So this is a thing that oftentimes gets overlooked. All right? Many places, even if they have insulation testing, we find aren't even testing the bipolar forceps, okay? So this is something to be really mindful of. We wanna make sure that just because it's not a laparoscopic instrument, it's still coated with insulation coating, insulation protecting, okay? And so we have to make sure that we test anything that has insulation and is used with electrocautery or even laser. So right now I'm also thinking about leap sets and things like that. Sometimes we have forceps that have insulation. Another thing to keep in mind, and this I mentioned, it's really important to have a kilovolts specific setting where we can adjust it to where we want. When it comes to bipolar forceps, this is relatively new information, okay? We found out from working with one of the manufacturers, we had a customer who's actually now on our team, but we had a customer who was experiencing bipolar forceps that were getting damaged repeatedly over and over and over again. It didn't even matter that they were, you know, replaced or brand new or anything like that. And it turns out the recommendation from the manufacturer was that they were testing the insulation at too high of a kilovolt setting. And what they recommended was nothing higher than 1.0 or something like that. So if you have a setup like this and you have bipolar forceps in your inventory, then you really need to make sure that you have a setting just like this. Thank you so much, Amanda, my assistant here. I now have my brush so I can demonstrate how to use the brush. And that was perfect timing because the brush is how I'm gonna test the bipolar forceps. And I'm gonna apply principles that we use in nursing or even physicians. You do the exact same procedure every single time so you don't miss a spot. And so I'm gonna start at the base and move up, kind of like I'm making an M formation. Now that was the top, so we expect it to beat there. But as I get further away, I don't want to hear any beeping anywhere else, okay? That's up here again. So I want to make sure I don't have any beeping here, but I'm not quite done. I finished my M. I did the outside and the inside of both tines. Now I'm going to do this way, okay, and this way. It's always beeping at the top. So this one is passing insulation testing. Another thing I want to point out here is that some bipolar forceps that you have, they look reusable, but this is a single use bipolar forceps. So you need to make sure if you get a single use bipolar forceps into your decontam or to your inspection and assembly station, that you have a way of discerning whether or not it is a disposable. One cue that you might look for is just this plastic on there, and I don't know if you can see that very well, but there's a plastic sort of channel for irrigation, and that tells me this is a disposable, all right? And it also says single use right on there. So my hunch was correct. So now you know how to use this electrode, the tri-volt electrode, the bipolar forceps electrode. One thing I can do while we're here is make sure I go back to the insulated handle and show you how to properly test the handle with the brush, okay? Remember, there are multiple ways that we can do this. I'm just showing you one way. The important thing is that you find a correct way and you do it repeatedly so that you don't kind of allow yourself to have variation in your practice. I'm going to move this brush electrode to the red wire. So now I have my green grounding on the post of this. I have my brush on here. I'm going to reset my kilovolts back to 2.8, which is the normal recommendation. But remember our lesson from the bipolar forceps. If the manufacturer recommends a different kilovoltage setting for insulation testing, you follow that. We have a general IFU for insulation testing and what the kilovolts should be set at. But if the manufacturer of the instrument recommends something different or specific, that's what you go by. All right, so basically now we can properly test. Now understand that in the middle, there's going to be a hinge there on laparoscopic handles, and that's okay. We're going to expect there to be a beep there. All right, but we want to make sure that we cover the inside and the outside of these handles, both components. Oh, I just found a failure right there. I don't know if that'll show up really well on the camera or not, but that is a failure. So even though this one passed insulation testing here, it failed on the handle. This one goes into the repair bin. All right, do not pass go. Under no circumstances, even if you have to take a set of instruments out of service completely. All right, so moving on, I want to talk about this last accessory here, which is going to couple, actually, I'll move this here. This last accessory is going to be really important, and a lot of you are probably not going to be familiar with this one. It is relatively newer. I'm going to set my kilovolts accordingly. This one is going to be designed to test reusable monopolar cords or bipolar cords, any reusable cord basically. All right, so I'm setting it to 4.2. I have my clip on here. I'm going to do my best to straighten this out without creating a knot. All right. Now this cord, as an example, has an instrument tracking label on it. So this is something that we got from a customer who is trying to track uses of the individual cord. And the reason for that is because a lot of these cords have limited lifespan. And I bet you OR nurses, a lot of times, we don't even know that. This one might have a lifespan of 25 uses. It might have 50. It might have 100. It has to be referenced in the IFU. You have to know, and that's why they were trying to track it. Now, I don't necessarily recommend putting a tracking label on the cord where you're supposed to be testing, because now when I go to test this, I won't be able to adequately test that part unless I remove it. So if you want to track the number of uses of your cords, I think that's a great practice. You're going to have to find another way to track it. But just for demonstration purposes here, what you're going to do is you're going to go from end to end, pulling this through the wire electrode. And what you're going to hope for is that you don't hear any beeping. That signifies that the insulation, this outer coating, the coating that you can see here, the gray, that signifies that it passes inspection and that it's not going to let any electricity out of the cord. And this is how you would do it, okay? You can see with, oh, there's my failure. It failed inspection. So unfortunately, this cord would have to get replaced, okay, immediately. This would not go back into service. However, for argument's sake, and for demonstration purposes, say this passed insulation testing. We need to do another test for all reusable cords, all right? Insulation is going to keep electricity from leaking out, but a continuity test like this one is going to help to make sure that there is no breakage of the wire, the metal wire that is insulated. So the inside, the internal part of this cord that you cannot see, similar to like a phone charging cord, when it has a short in it and you have to put it in a specific position just to get the electricity to go back through it and to get your phone charged. That same concept can happen with an insulated, reusable, monopolar or bipolar cord. And that's why we do a continuity test. The difference between a main difference between a continuity test and an insulation test is the insulation test is going to be using more voltage. It's going to be using a higher voltage than this continuity test. We want low voltage so that we can tell that the electricity is getting from A to B, from end to end, without having to arc within this insulation. We don't want the electricity to have to jump from broken end to broken end. When that happens, what that looks like, what that could look like in the operating room, it could look like a couple of things, all right? One, the doctor might not be getting the result of the cauterization that they expect. They're normally getting the bleeding to stop, but this time the bleeding is not stopping as well, so they ask you to turn the power up. And now more electricity is jumping that break in the wire. Now, sometimes you can go off without a hitch and nothing happens. However, there are times, and this is me going back to my experience before I finish this demonstration. I want to illustrate this for you. Imagine the doc's doing a gallbladder surgery, you're circulating, or maybe you're scrubbing, and they're just going away, you know, trying to get the gallbladder off the liver bed, and they're using heavy cautery, right, with their L hook or their Metzenbaum or whatever, it doesn't matter. But they got cautery going through here continuously. They're just trying to get the gallbladder off the liver bed. But if there's a continuity problem or disruption in here and they're just cauterizing away, this wire, especially at points of stress, it could be at this end, it could be at the other end, can explode. It literally will explode in the operating room. And that actually happened in my experience. I was working with that same busy general surgeon, and he was doing his gallbladder marathon days, and literally in the middle of the dark room, it just exploded, and we were all like, what in the world just happened? And that's when it prompted us to look at what the IFU said, and that's when we discovered that these cords have limited lifespan. We had no idea before that. And during that same week, multiple cords did the exact same thing during a gallbladder surgery. So my guess is that we bought a bunch at a specific time, and they just got churned through and used up, and they all were failing right around the same time. And unfortunately, back then we didn't have a continuity test. We didn't have this thing to use to show that we had continuity in our cord. So really quickly, how do we do that? We have a monopolar side. I'll see if I can show that to you better. This is a monopolar side. We have a bipolar side, all right? And then a toggle switch. So if I want to test the monopolar side, I'm gonna toggle this over here. You can see my blue light is on. That shows that I have power. And what I'm gonna look for is this green light, all right? So what's important here is that, yeah, we have a green light, that's a good sign, but we don't wanna stop there. We wanna watch that green light, and we wanna make sure it doesn't flicker, just like a shorted iPhone charging cord, you know, like it'll flicker, like it's not, it'll charge and then it'll stop charging. We wanna kind of move these cords around and with our eye on that green light and make sure it doesn't flicker. Okay, if it flickers, we know there is a weak point in the continuity of that cord. So as a recap with the cords, we have to do an insulation test. If you don't have this handy dandy wire tester, the only way to do an insulation test would be with a brush. Imagine trying to brush this entire cord up and down circumferentially. You see this electrode covers circumferentially. You just pull it through and it's testing all of the circumference of that cord all at the same time. You don't have to worry about trying to brush all the way up and down and all the way around. There's no way to reproduce a quality inspection with the brush. It's better than nothing, but there would be no way to do it reproducibly with high quality. All right. So that is the main components of the how behind how do we do proper insulation testing. We want to make sure, again, that we can look at any instrument and see, is it insulated? Yes or no. Is it insulated on a handle? Yes or no. If it doesn't, if it has metal or if it's plastic on the handle, you're not going to test it. You're going to test the insulation that you see, all right? It doesn't matter what the instrument looks like. If it's insulated, you should be testing it, okay? We have a lot of different accessories here to accommodate all the different types of instruments, including cautery cords, which is called out in AAMI ST79 Amendment 2. So those amendments, remember, they came out in 2020, 2021, and many people are not aware of them. The other thing is that I didn't talk about in the very beginning is these gloves, okay? Make sure that when you perform insulation testing, that you put gloves on. Unless you don't like yourself and you enjoy getting shocked and things like that, I recommend wearing gloves, because even though it's not gonna kill you, it's not exactly pleasant. So I would imagine that most of you out there would enjoy putting gloves on and preventing yourself from getting shocked. Another thing to keep in mind is my table here is not exactly like the ones in sterile processing. The ones in sterile processing are often stainless steel countertops. So if you're leaning your bare arms on there while you're doing insulation testing, you could get a shock there. So wear your sleeves or keep your arms off the table. Those are some tips to keep in mind to prevent any unintended shocks. So that is, I believe, the conclusion of all the how to do this stuff. All right. So what I want to do is quickly wrap up with showing, let's see. Whoops, wrong button. Sorry, guys. I'm still here. I'm still here. All right. All right. So we have one remaining poll question, and I want to let Linda do that. So this is a reminder. All right. We want to go back to that same poll question from the beginning. I want to make sure that I did a good job here. So in that same study conducted by Sharon Rojo, what percentage of nurses experienced an insulation failure? Are we all going to get it right, or did I fail? I'm going to take it personally if you guys didn't get this right, just so you know. All right, okay. Whew. All right, thank goodness. All right, so one thing I would like to do before we just go into the Q&A is also recap. What are you going to do with this knowledge? Okay, and it depends on your position. Speaking to you guys who are nurses that are on this, please understand, no, in most cases, you're not going to be responsible for how to do the insulation testing. But what you do know now is that this is a critical part of safety in the operating room. All right, so I would expect that you would now have some curiosity about what's going on in your sterile processing department, enough curiosity that you will either physically go to your sterile processing department and ask to see what the insulation testing protocol is and if they're doing it. And also keep an eye out in the operating room for any unintended electrical strays that might be happening during surgery. I would also expect and hope that you will share this information with other OR nurses or colleagues that should know about this. I will tell you from my personal experience, gosh, I wish I would have known this before I was managing sterile processing. If I would have known it during my operating room days, that could have changed my practice for the better. I could have been a safer circulator, a better scrub nurse, a better first assist, all of those things could have made me better. I could have actually helped educate the surgeons as well. So those are things I really wish I knew as an operating room nurse. For those of you who are IPs, please get curious, go and see and have your sterile processing department demonstrate how do they do how do they do insulation testing. Ask them to show you how they do it. Start getting involved in sterile processing, perform audits, take a laparoscopic instrument set, lap chole, whatever it is, general laparoscopy. Take that set, open it up, and audit it. Make sure when you test it, you get all the proper results or the expected results. You don't want any fails making it into a patient-ready surgical instrument set. And for those of you in sterile processing, please, I know there's pressure, enormous pressure on you guys to meet deadlines and to meet the needs of all these surgical cases. Please, please, please do not skip this step. It doesn't matter the amount of pressure that's on you. This is literally life-saving technology, life-saving inspection steps. You need to do this and stand up for it. If someone is pushing you to not do it, that's a time where you should put your heels in the ground and actually push back and say, I'm going to do this because it's my practice, it's my conscience, and I need to be able to sleep at night. That's how serious this is. We have to make sure that we own our practice, regardless of the circumstances in our department. If the equipment isn't there, you can start advocating for the equipment. If you're a manager of sterile processing, advocate for the equipment, the training, get the competency going, get that competency going on an annual basis, participate in audits, pull those instrument sets off the shelf, perform your own inspections and make sure they line up, you're getting the results you expect. Do all of those things. Educate the operating room. Have them watch this webinar on demand afterwards if you're not sure you have the command of the information like you would like, or just go to their department meetings and start planting the seeds that, hey, we are now aware of this need for insulation testing, and we are going to implement, and we want to make sure that you guys are aware of why we're doing it and what it looks like if something goes wrong, so that you can help monitor this for us in real time. So those are things that I would like to have for you guys to have as takeaways. I hope that in your mind you're thinking of different ways you can go back and either adjust your own practice or educate another nurse or a scrub technologist, another manager, another department within your health system. Make a difference with this technology, and when you do, tell people about it. Communicate to your OR customers, communicate to your surgeons, communicate to the infection control committee that's wondering what sterile processing is doing, right? Tell these people so that they know that you're advocating and you're putting into place steps to keep their patients safe. So I just want to thank you again for hanging in there and for being with me on this first time doing this kind of webinar. I hope you found it helpful. And at this time, Linda, I think we can get to any questions that the audience might have had while we were going through that.
Yep, we have quite a few, Kevin, but I just quickly want to point out to the attendees that there is a handout on their dashboard if they want to download it. Okay, so the first question that's come in is, how do we know if we have an effective insulation testing program?
Yeah, so it's a great question, and one of the things I've already mentioned, actually two of the things I already mentioned is what I would come back to you with. So one is to actually watch what your staff is doing. So when I was the manager and I learned about this, I asked my lead tech, I'm like, are we doing this at all? Is there any insulation testing going on at all? And he told me no. So I knew the question, my answer right away. But if someone tells you, yeah, we do that, and then the follow-up question is, do we do it every single time? And they still say yes. Then you ask, are you confident that it's being done every single time correctly, 100% on every shift? And if they come back at you with a yes or a no, it doesn't even matter. What you need to do then is say, all right, that's great. I'm going to go back. I'm going to look at the training records. I'm going to look at the education records. But better yet, I'm actually going to take a set off the shelf and perform the audit myself. I'm going to be trained and competent in doing the insulation inspecting, and I'm going to perform audits on ready for patient use surgical sets. And if any failures get through to my ready for patient use surgical sets, that's gonna be a huge KPI and a huge quality initiative going forward. The other thing is, when you do that, get to know your equipment. Not everyone has the equipment that I'm showing you here. See if you can conduct all the tests that I laid out for you with the equipment that you have. If you can't, then you need to upgrade your equipment. The last point I would say is, please don't make this out to be some sort of, yeah, that's nice. We'll just get one and put it in the corner in our inspection station. This is vital equipment. This should be at every single assembly station. You shouldn't have a technician wondering where the equipment is. They should never have to open up their set and see that an accessory is missing and not have a backup to go to get that accessory. They really, for lean purposes, they shouldn't have to leave their area. They should be able to just pull it off the shelf, open it up, and get to work, get the inspection done. So those are some of the tips I would add for making sure that you have the proper insulation testing protocol going on in your department.
Okay, so following on from that, I'm an OR circulator. How can I use this information to improve my practice?
Yeah, so this is another one that, I hope that the light bulb went off as I was talking and also showing those examples in the beginning of real surgeries. One, that you share the information with other OR nurses and surgical technologists to make sure that they have an awareness to watch for this kind of thing while they're actually doing surgery. So when you're done with your charting or when you're just observing and making sure everything's going smoothly, that you're actually monitoring what's going on and looking for any potential electrical strays. If you're an OR nurse that manages a sterile processing in an ASC, make sure they have the equipment, make sure they have the competency, and show them how to do audits and make sure that they are not allowing any failures to make it through to any patients.
Okay, an equipment question here is, our insulation testing equipment doesn't currently have an accessory to test the insulated cords. Would your cord testing accessory work with other equipment?
Yeah, so that's a good question, and it is a common thing that we find. What the question was referring to is this wire testing device that I demonstrated that tests for monopolar cords and bipolar cords. I did demonstrate that you can do a test with the brush. The problem is it's not very effective or very efficient. Unfortunately, I can't recommend that you use this wire tester with any other equipment than the McGan. So what I would do is recommend over time is to add this whole setup to whatever it is you currently have, okay? Just because you have something that you can't do that with doesn't mean you have to necessarily throw it out. Keep it there, get this whole setup so you can do your cords and maybe replace old equipment, because this is sort of newer and with newer expectations and newer knowledge, and that's part of the reason why we have that accessory in the first place. So you might just have to replace old equipment over time. That would be the best scenario.
Okay, so how many uses are the cautery cords good for?
Okay, so that's another one where it's going to depend on the cord. The cord is, I've seen some of them that have different verbiage, okay? Some of them will say, this one's good for at least 100 uses. Some of them will say, this one is good for 25 cycles or 50. So the verbiage is different. I encourage you to learn about the ones that are in your department. So you find the model number. Sometimes it's right on the instrument. Usually with anything reusable, there should be a model number or a reference number, a catalog number. That's where you would take that number, you would plug it into one source. A lot of people have one source out there, or wherever you have your IFUs, and you would check that specific IFU because they're all a little bit different, unfortunately.
Okay, perfect. Right, we've got time for about one more question. What should we do if we suspect an insulation failure during a procedure?
So hopefully you got the hint a little bit earlier. If you had a suspected insulation failure during a case, I would ask a couple things. Number one is to do whatever you need to do in the immediate near term to mitigate that problem. Go and get another set of instruments, replace whatever instrument you suspect had an insulation failure, and get it out of there. Get the repair tag on it, get it out of circulation immediately. The other thing is to please, whatever you need to do, make a note, make a policy, make it a procedure in your facility to go back and report that issue in the FDA MAUDE database so that issues like that can be tracked and trended, and the FDA can be aware of these things so that they can make sure that advancements and changes are made with these devices, and the risk over time diminishes for everybody, because maybe this is an old design that could be upgraded and people don't have to suffer these injuries because we're just using old designs. So please make sure to add that, you know, do the immediate mitigation measures and then report the issue to the FDA MAUDE database. Anything else, Linda?
Well, the only thing I can think of for you is to wrap up. What would be your top tip?
Oh gosh, my top tip would be to take something like this. We also have, you know, you could use this webinar because it talks about the why a lot, but my good friend and colleague Sharon Rojo has done a YouTube video that lives on Healthmark Education that shows the tutorial. It's all the how, so it's a lot shorter. It's like a 13-minute video, and you make sure you test your skills against what you learned here in this webinar or against that YouTube video. You make sure that everyone on you, as your own practice, you make sure you're confident and comfortable with your level of knowledge and expertise with this. But if you're within your span of influence, you need to make sure that everyone on the team has that same level of training and competency and confidence with this inspection step, because like I said, it's life-saving. One pitfall I will explain, since we do have a minute still here. I went to, I think, 2 different facilities that were outsourcing laparoscopic instrument or minimally invasive instruments to a third party for decontamination and inspection purposes. And those 2 facilities that outsourced it, by virtue of outsourcing decontamination and inspection, they effectively outsourced the insulation inspection step. All right. Both of those facilities had failures in their insulation on basic laparoscopic instruments. So one of those facilities, I found out that the third party was only testing each set once a week. All right. So remember, this is not a once a week activity. This is not a once a month. It's not based on usage. It's every single time it's processed, every single time you do it completely, every single time. It doesn't matter how long it takes you. Hopefully, over time, as you do it more frequently, you will get faster and more efficient and more effective all at the same time. But in the beginning, it will take you a little bit longer, and that's okay. Just stick with it because it's important and necessary for patient safety.
Perfect. Thank you so much, Kevin, for your time today and for a really great and informative presentation. Thank you. Please visit Healthmark's website, hmark.com, to learn more about the products they provide for the industry. Now, as promised, the answer to today's trivia question is pink. So congratulations to our winner, Alison Sholton. Now, just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your certificate, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Please visit ortodaywebinars.live for more details of all our upcoming webinars and, of course, complimentary registration. Just a quick reminder that if you've missed any of our past OR Today webinars, including any by Healthmark, you are still able to view them on our website, ortodaywebinars.live. So thank you all for your time today, and I hope you enjoy the rest of your day.
Thank you.